Now let's go over the different types of diabetes, starting with type 1. So can you talk to us about this type of diabetes?
Sure. Type 1 diabetes is usually considered autoimmune. It usually occurs at a younger age. And this is because there's no insulin being produced from the pancreas. And so that can happen for a number of reasons. It could be related to genetics, it could be related to a virus, it could be related to an illness or injury, or we may not even know why it happens. But essentially, the pancreas is not producing insulin. And so at a younger age, we see an earlier onset of diabetes.
And this could be also hereditary?
Yes, it can be hereditary as well.
Now, why is type 1 less common than type 2?
So we tend to see a little bit more of type 2 diabetes, and that's partially related to lifestyle, the increase in prevalence of obesity, and these are reasons that we're seeing more diabetes type 2.
Okay, so now we're talking about type 2 diabetes, which works differently and would affect different people. So what can you tell us about type 2 diabetes, Dr. Sharma?
Sure. So this is what we see more commonly. It does affect more adults. Listed on our graphic is age 40, but actually we're starting to see it at a younger age.
Wow.
And that has to do more with lifestyle.
How much younger?
Yeah, we actually are seeing more patients in their late 30s, 35 onwards. The pancreas is still producing insulin, it's just not quite enough, or what we see commonly, which is an insulin resistance state, which is there's just so much blood sugar that the insulin receptors aren't even that sensitive to the sugars because there's just sugar all the time in the blood. So these are the kind of underlying pathologies to what happens with excessive sugar intake and what's more of an adult onset diabetes.